Hi, I'm Faith, your nurse navigator. Today we are talking about type 2 diabetes. When you eat, glucose molecules are transported towards the cell membrane. Insulin binds to specific receptors located on the cell surface. This binding triggers a signaling cascade within the cell. The signal prompts glucose transport channels to open. These channels facilitate glucose entry into the cell's interior. Inside, glucose is used for energy production and cellular functions. The pancreas produces insulin when blood glucose levels rise after eating. Beta cells in the pancreas are responsible for insulin production. These beta cells synthesize insulin within the pancreas. The synthesized insulin is then secreted directly into the bloodstream. Insulin is released into the bloodstream in response to elevated glucose levels. It acts as a signal, traveling throughout the body to reach various cells. Insulin binds to receptors on cell surfaces, initiating a process. This binding unlocks cellular pathways, allowing glucose to enter cells. As glucose enters cells, blood sugar levels decrease, restoring balance. In type 2 diabetes, cells develop resistance to insulin's effects. Insulin is present, but glucose transport channels do not open properly. This impaired channel opening reduces glucose entry into the cells. Reduced glucose uptake contributes to elevated blood sugar levels. Insulin resistance causes glucose to accumulate in the bloodstream. This accumulation leads to elevated blood sugar levels. Elevated blood sugar is also known as hyperglycemia. Excess glucose in the blood can damage various organs. Organ damage occurs gradually over an extended period. Managing blood sugar is crucial to prevent long-term health issues. High blood sugar can significantly damage blood vessels over time. Damaged blood vessels increase the risk of heart disease. Stroke risk also elevates due to blood vessel damage. Plaque buildup in arteries is accelerated by high blood sugar. Arterial narrowing further restricts blood flow, endangering the heart. Kidneys filter excess glucose from the blood to maintain balance. Prolonged high blood sugar can overwhelm the kidney's filtering capacity. This excess glucose damages the nephrons, the kidney's filtering units. Nephron damage impairs the kidney's ability to filter waste. Progressive nephron damage can lead to chronic kidney disease. Managing blood sugar is crucial for preventing kidney damage. Elevated blood sugar levels can harm small blood vessels in the retina. Damage to these vessels can lead to various vision impairments. Retinopathy is a common complication of diabetes. In severe cases, this damage can ultimately result in blindness. Elevated blood sugar can damage nerves throughout the body. This damage often leads to neuropathy, causing numbness and tingling. Pain can also occur, particularly in the hands and feet. Neuropathy is a common complication of high blood sugar levels. A balanced diet is crucial for overall health and well-being. It should include a variety of non-starchy vegetables for essential nutrients. Lean protein sources are vital for muscle maintenance and repair. Whole grains provide sustained energy and fiber for digestive health. Portion control is essential for managing blood sugar and weight. Regular physical activity enhances insulin sensitivity. Improved insulin sensitivity helps cells use glucose efficiently. Efficient glucose use leads to lower blood sugar levels. Examples of beneficial activities include walking, swimming, and cycling are also effective forms of physical activity. Blood glucose meters help monitor how food impacts glucose levels. They also track the effects of physical activity on blood sugar. Medications' influence on glucose can be assessed using a meter. This data supports informed decisions for managing diabetes effectively. Insulin injections supplement the body's insulin production. They are crucial for individuals with insufficient insulin. Injections help regulate and control blood sugar levels. This is a key component in managing diabetes effectively. Oral medications are designed to help manage blood sugar levels. Some enhance the body's sensitivity to insulin, improving its effectiveness. Others stimulate the pancreas to produce and release more insulin. Certain medications reduce glucose absorption in the intestines. Tracking blood sugar levels helps identify patterns and trends over time. Analysis allows for adjustments to diet for optimized blood sugar control. Exercise modifications can be made based on blood sugar level analysis. Medication adjustments can optimize blood sugar control. Managing type 2 diabetes requires continuous learning and adaptation. It is an ongoing process, not a one-time fix. Collaboration with healthcare professionals is essential. Optimal health outcomes are the goal of diabetes management. Lifestyle adjustments are key to managing type 2 diabetes effectively.
This video is for education and entertainment purposes only and does not replace professional medical care or advice from your healthcare provider. Contact your healthcare provider if you have questions or concerns about this topic. Follow for more nurse-led education.